My name is Dr. Rick Korsman. I'm a medical doctor, and over the years, really for over 20 years, my whole area of work has been helping people around food, eating, weight and body image concerns. A healthy lifestyle, or taking care of ourselves in the best way we can, when we can, has a huge effect on our mental health and well-being. And what I've seen so much over the last 20, 25 years is people beating themselves up about not doing it right. So they've been told they should eat a certain way. It's often been told to the person that an all or nothing way, so that a person, the moment they aren't able to follow a set of rules, they feel badly about themselves. And from a mental health point of view, I see so many people who are distressed around that. They may well say, look, life's going well in lots of areas, but around food, I haven't got any willpower. That's a common thing that people will say. And they're getting confused with what sort of skill is helpful around food. Now, willpower is a nice skill to have for a number of things in life, but with food, it's not a great skill at all, because willpower is a short-term skill. We can apply willpower for a short period of time, but we can't, for example, follow a set of rules as a way of eating forever without listening to our body and without trusting what we feel like, without listening to how hungry we are today. So people have become understandably confused by what is the best way of eating, become distressed because they feel like that they're not good at it and haven't been able to follow the rules that they've been told they should eat. And that's incredibly distressing for people because they feel like that they're a failure. Another important area of mental health is that so many people feel disempowered in their relationship with food. For example, many people will say that they can't have their favourite food in the house, otherwise they eat it all. So what happens is, and this is a quote from one of my patients, she said that she doesn't have chocolate in the house, and there's sort of a pause and says, but I buy a lot. Now, that is not a helpful way of operating around food, is to not feel like I can't trust myself around food. In the end, of course, all the foods are so available that we end up having it anyway, and often then overdoing it. And that's a very unhelpful thing that's also developed over the last couple of decades, is that people have become disempowered in their relationship with food. And it's much better to be able to practice, and it takes some practice, to allow themselves to have the food that they really feel like. Eat slowly, savour, enjoy, do the best they can to stop when they've had enough. That's the best way of having the right amount of food at that time for that person, rather than, again, sticking to some rules that have got nothing to do with our body. So from a mental health point of view, many people are feeling distressed and like failures because they can't follow a set of rules. They're impossible to follow. And are feeling disempowered in their relationship with food because they're not trusting themselves, because for many people, for many years, they've been told, you can't be trusted, don't have this food available for you, and of course, if we like it, of course we're going to eat it sooner or later.